Well, the uncertainty of this situation, from the closures to the social distancing, can really take a toll on us physically and emotionally. I interviewed a mental health expert and asked him some questions from viewers about how we can cope right now. The first viewer question that we have comes from Anne Marie. Anne Marie wonders, how do you deal with the constant anxiety about hearing about the news? How do you wind down and relax? I feel like I've been anxious for a week straight.
Yeah, I understand what she's talking about. Some of us, well, the super easy answer is to not watch the news. Okay, but that's very difficult because we're trying to all get updates and trying to stay connected to what's happening in the world. So it really boils down to putting a time limit on yourself and to making sure that some of the things that you're watching are not news related. They're something fun like a cat video or a comedy or something like that.
How about this idea of just physical health, keeping your own health going? I mean, can you kind of give us a little bit of an idea about what she could do physically to, if she's able to keep going and relieve stress?
I think most of us who work in the mental health profession understand that physical health and mental health do go together. And so anytime you can literally exercise your body, do things that are within your control to improve your physical health, and that means moving around, exercising even if it's at home, signing up online to join a virtual yoga class or a bicycling class, something that even is free is really good. And that has great benefits for your mental health as well.
Okay, Kimball, our next question comes from Joy. Joy wonders, what can be done to ensure the mental health of senior citizens who are now on lockdown and cannot see family or even their fellow residents with communal dining, activities, etc., especially those with cognitive impairment?
I think it's important to, if you can, number one, if you have a family member or a friend that's in this kind of a condition, to reach out to them several times, perhaps even in a day. It could be brief contacts, just a few minutes each. But also, I think, depending if they're able to understand and still read and whatnot, this would be a good time to send cards and write a letter to somebody. I think they would enjoy that.
It's a good idea. Our next question comes from Christina. I have social anxiety. I'm an introvert. I can also very easily become agoraphobic. What can help me handle the stress of going to stores that are packed with people, especially when this is all over?
So one of the things that can be very helpful for folks that have a lot of anxiety is using some apps. And we'll probably have that on your website, I suspect, Scott. I sent you a variety of free apps that you can download that some of them which specifically address anxiety and how to handle those things. So you want to get prepared for yourself prior to going out and to being in the public. But there's definitely ways to use breathing techniques and imagery and self-talk that's appropriate and will help.
Okay. Hillary writes and wonders, what can someone with severe mental illness do to help alleviate the anxiety and stress of life not being normal, especially now that some psychiatrists and therapists are not taking patients face to face?
I think there are many types of vulnerable populations that are affected even more acutely during this time. Some of the elderly and some folks that have certain chronic health conditions, whether that's physical or mental health. So this is also where if you know of a friend or family member who has a mental health illness, that you really make an effort to reach out to them frequently, even if it's just, a few minutes of contacts every day, every other day or whatnot during this time. Those things help. In addition, that certainly people do have rights. If you have a disability, you have rights, and that will afford you ways to protect your job and things like that.
Linda wonders, my anxiety hasn't been triggered as much as my depression. I need suggestions. So what suggestions would you give Linda?
Sometimes it's, for some people, it's difficult to tell the difference between anxiety and depression. They do have some symptoms that overlap. But I think mostly folks who have depression, especially during this time, really benefit from appropriate social contact. Okay, so that means let's keep our distance, maybe even virtual telephone contacts would be appropriate. So make sure you reach out. Do not withdraw from people. Okay, reach out or ask people to be in contact with you. That's the important thing. That it's a nice way to take care of yourself, to remember to ask for your own care. Ask for what you want.
Well, throughout this half hour today, we're getting answers to some of your biggest questions about this pandemic.
Yeah, some people have been